Hi everyone. So let's not delay. Let's start. So first of all, I can see Dr. Mahadev Bhatt, sir. You're welcome. And guys, I welcome you all to this wonderful exclusive webinar on drug-related problems and their overcomes. So this is, not the topic title, but the book title, what is written by our today's expert, Dr. Neha Suratiya, Dr. Neha Rajput. She is assistant professor in Parul Institute of Pharmacy, Parul University. Still, my team will, someone from my team will introduce her later. But let me tell you a bit about this webinar. I was just talking to Dr. Neha about her book, and I came to know this is, I mean, as well as we all know, this is a wonderful topic for all the pharmacy people, all the nursing people, all the beginners in the medical field also. Drug-related problems. We have, a lot of medical errors. We have a lot of contraindications. We have a lot of drug interactions. We have a lot of drug disease food interactions and multiple things. So there are plenty of drug related problems which must be solved and need to be solved, right? So what are those problems and how to resolve those? Today we have our expert to discuss with us, right? So it is a part of our ongoing emergency medicine course also, guys. Okay, we are running the pharmacist in emergency medicine. So this is a part of that course also, the webinar. So guys, please try to learn and ask as many as questions you can ask. And see, drug related problems are not only happening in the hospitals with inpatients or with outpatients, but these are the problems usually happening with the emergency medicine patients also, because there are all the stakeholders, all the team members, whether they are emergency medicine physicians, whether they are radiologists, anesthesiologists, nurses, clinical pharmacists, they all are in hurry, and they are sometimes miss the things in hurry to save the patients, right? So there are multiple things what we would like to discuss. So without delaying the things, I would I can take the entire hour, but I'll not take, because this is the day for Dr. Neha, guys. So over to my team, Dr. Sakina. Let's introduce our today's speaker and hand over the mic to her. And I'm very happy to see our participant. Our Zoom is full capacity right now, 500, and in YouTube also there are 200 plus. So thank you very much everyone for the faith and the trust you are having in us, and we are not disappointing you at all. We are coming up with a lot of things under the climate, under our all the ventures for you, that is either free of cost or low cost. So please stay connected, and over to Dr. Sakina to take care, and then to Neha Surutiya. Neha, thank you very much for connecting with us and getting agreed to take this wonderful seminar, exclusive webinar for our students and people here.
Thank you so much, sir.
You're welcome.
Yes. So let me quickly introduce our honorable speaker, Dr. Neha Suratiya, PharmD. She is an assistant professor at the Parul Institute of Pharmacy, Parul University, Vadodara, Gujarat, India. She is author of book under the title Drug-Related Problems and Their Overcomes. With that, she authored 8 paper publications in various national and international journals. She participated and presented in various national conferences, webinars, workshops, seminars, panel discussion, FDPs, etc. She was certified to serve humanity during the COVID crisis at Dheeraj Hospital. She developed knowledge in clinical and pharmacy practice area, making her an expert in this field. Her vision is to create a service provider by utilizing clinical skills and motivating away from current supply-based model. So we are honored to have you, ma'am. Please take over.
Thank you. Thank you so much, madam, for that kind introduction. Good evening, one and all present here. Myself, Dr. Neha Suratiya, and thank you so much for having me here. So without taking more time, let's get into it. I will share my slides with all of you. And if you face any difficulties in online platform, you can raise your hand and you can share your thoughts into it. Okay, I hope the slides are visible and the audio is clear.
Yes, ma'am. It is visible.
Thank you.
Okay, just one more simple announcement, guys, for all of you. So you have to stay till end if you want to get the certificate and fill the feedback form. Okay, that is your attendance form, not exactly the feedback form. Okay. Yes, please go ahead.
Can I take 1 minute as I'm facing one issue with the playing?
Sure, Neha, please go ahead. Please check. Feedback form at the end of webinar, not before that. I want you to listen to the webinar and learn. Sir, namaste. You are on mute, sir. Very happy to see you again after a long time. One hour, guys, 1 hour.
Okay, shall I start, sir?
Yes, please go ahead, Neha. Please go ahead.
Okay, so we all know that every effect of the drug comes with the side effect of with it. Okay, and that is the topic for today's discussion, that is drug related problems and their overcomes. As its name suggests, all the problems related to the drug comes under the umbrella of drug related problems, right? And that might further leads to the n number of unwanted complications and problems, and all those problems comes under the title itself. And what's new in today's topic of discussion, that is, I will discuss some already existed drug related problems. Also, we'll discuss some detection technique, how we can detect the drug related problems and how we can further overcome it. So I will share some ideas to detect and to overcome it. So let's get into it. The very first slide, that is containing the drug related problem definition. It is very simple. It refers to the issues that is arising from using medication or the drugs, that including prescription of the drugs, over the counter medication, and some illicit substance, right? And we can say that DRPs can occur at various stages, such as prescribing, dispensing, administering, and the monitoring medication. And these problems can negatively further affect the patient's health, safety, and well-being. As healthcare professional, our foremost duty is to maintain a safety and well-being of the patient. We cannot compromise on that thing. So, and that drug-related problem is negatively affecting that thing. And that is the main reason why we are studying that topic today. Let's understand various types of the drug-related problem. As you all know, there are various types, like a very popular drug-related problem, that is the very first adverse drug reaction, right? And some drug interaction, further classified as drug-drug interaction, drug-food interaction, and drug-disease interaction. Some medication errors, some non-adherence, obviously medication non-adherence, overdose and toxicity, abuse and addiction, inappropriate medication use. These are some drug-related problems. Another three are overuse and underuse of medication further leads to a number of complications. Medication related falls, some sedative and hypnotic drugs can lead to fall and inability. So that is further medication related falls. And very popular polypharmacy, that is also the drug related problem cause. Let's understand one by one. But before starting the actual topic, I always told the student, or I always suggest the students, that if you are learning a new thing, if you are learning a new topic, then your why should always be strong. Why this topic? Why this webinar? So that why should always be strong. And to justify that why, I included some statistical finding, that is real statistical finding on behalf of observational prospective studies. And I included that thing in my PPT to show you guys the importance of drug-related problems. So this is the study, which is observational and prospective study related to drug therapy problems in the medical ward of a referral hospital in the northeast Ethiopia, and that is the country in the East Africa. And you can see that thing, that 35.85% that is needs of additional drug therapy in the related problems, and 30.19% are the unnecessary drug therapy prescribed. And in the gray part, you can see 13.20%, that is the doses are the too low for the therapeutic efficacy, right? So this is the real statistical finding, that is the real observational study which is done in the East Africa country, and that shows that at what level the drug related problems are occurring. And one more example I put, that is in our country, that is South India, and that shows some drug related problems during discharge summary, right? See, that is that diagram shows P1.1, 1.2. Now these are some domains. P1.1 suggests some effective treatment, P1.2 suggests some non-effective treatment, 1.3 suggests some additional treatment. But any of the domain, you can see there is in the on the y-axis percentage of patient related to drug related problems. You can see either the treatment is effective or not, the drug related problems are occurring in at any cost, right? So drug related problems among inpatient of general medicine department of tertiary care hospital in the South India suggest in the discharge summary as well, the drug related problems are occurring at the higher level, right? So this is the reason why we are discussing this topic today. So as a result and the conclusion, you can see out of 300 patients, 78.7% had drug related problems, and the incidence of DRP was found to be very, very high. Obviously, that is normal that the age play an important role, as the greater than 60 years of age, gender again is important, and the polypharmacy and non-adherence occurs. Non-adherence meaning patient is not able to, remembering at what time, at what dose the drug should be taken, and then non-adherence takes place. Medication non-adherence takes place. Other comorbid condition that can play an important role, as they suggest, polypharmacy and comorbidity is proven statistically that they play an important role. But the conclusion is DRPs are emerging issue within the confines of the healthcare system and should be, scrutinized to avoid the negative outcomes. And a stage-wise analysis of the patient who are at risk will ensure better the patient care. So the conclusion is DRP is, emerging issue. So that is the only reason why we are studying a drug related problem today. Let's get into it. The very first and foremost, polypharmacy. Now that is the main issue. We are aware about it, that polypharmacy is all about for the geriatric population, and that is more higher rate of polypharmacy related drug related problems in the geriatric one as compared to the adult one, right? So patient, or we can say a person, is in a confusion, always in a state of confusion, that at what time, at what dose a drug should be taken. So polypharmacy refers to the simultaneous use of multiple medications by an individual, typically involving several prescription drug, OTC medication, or dietary supplement. And it is commonly seen in individuals with the chronic or a complex medical condition, especially older adults who may have the multiple health conditions requiring ongoing treatment. So that is all about polypharmacy introduction. I want to tell you that I am going to discuss the all the domain in the three major category. We'll see the introduction, basic one, and then we'll jump into the problems that is associated with it. Then we'll see the detection part, and then overcomes. Okay, so that will be on a 3 level: the problem itself, the detection of it, and the overcomes of it. So let's see that. See, there is the problem which is occurring with the polypharmacy. You can see some statistical findings like polypharmacy can increase the complexity by 10%. It can increase the 20% drug interaction chances. It increase again 30% of adverse effect, and 40% medical non-adherence chances increases with the polypharmacy. So to mitigate the risk associated with polypharmacy, it is crucial for us as an healthcare providers to engage in the comprehensive medication management that include further regular medication review, patient education, monitoring for side effects, and close communication with patients and the other healthcare providers, in fact the caregivers, right? So that is the main thing. Let's see some problems which are associated with the polypharmacy. So very first is the adverse drug reaction, right? Adverse drug reaction, the risk of experiencing ADR increases with the number of medications that is being taken, as we all know. And certain medications may interact with each other, resulting in unwanted side effect or some toxicities. That is the first one. Second is the medication non-adherence. Managing multiple medication can be complex, and that is overwhelming for patients, especially the older ones. And it can lead to some confusion, difficulties in remembering to take the medication, and some challenges in following complex medication schedule. That is non-adherence. Third one is increased risk of the drug-drug interaction. We can understand that if the more drugs are there, there is more increasing risk of the drug interaction, right? Falls and the cognitive impairments. Certain medication, particularly those with a sedative effect or that affect the blood pressure regulation, can increase the risk of falls and the cognitive impairment, that is inability. Medication burden. Managing multiple medication can impact an individual's daily life, causing further medication burden, and that is always affecting patients' health-related quality of life. And that further include the confusion stage, emotional distress, etc. Fragmented care and lack of coordination. Now, when the individual receives care from the multiple healthcare providers who may prescribe medication independently, there can be a lack of coordination. Chances are more, and the communication. So this fragmented care can contribute to the polypharmacy and increase the risk of medication related problems further. And the last is the financial burden. We can all relate with that thing. If the more drugs are there, more financial burden on the patient. The second thing, that is detection of the polypharmacy. Now, the detection of polypharmacy is typically involve a comprehensive review of a patient medication regimen. And here are some approaches and indicators that can help further in identifying the polypharmacy related issues. Very first issue, that is, we can say the detection technique, that is medication review. Now, healthcare providers can perform a systematic review of the patient medication
Dr.
regimen.
Neha,
Yes, sir.
sorry to interrupt, I think, but your video quality is not coming at all. Can you please try to share the screen again, because video quality was not good.
Can I take 1 second, sir?
Yeah, it's not clear at all. Yeah, now it's clear, I believe. Yes. Right, guys?
Is it visible?
Yeah, now it is quite good. Yes, clear.
Okay, sir.
Yeah.
So in detection of polypharmacy techniques, we can further use that medication review, a comprehensive review, right? The second is Beer's criteria. Again, very, very important. The Beer's criteria for the potentially inappropriate medication use in the older adults is a widely recognized tool that provide a list of medication that may be potentially inappropriate for the use in the older adults, right? Due to their risk of adverse effect increasing and the limited further effectiveness. So consulting the Beer's criteria can help to identifying the medication that may further contribute to the polypharmacy related problems. The next is screening tools. We can use some screening tools like MAI, that is Medication Appropriateness Index, MAI, Medication Appropriateness Index, that can be used to assess the appropriateness of a medication regimen. Now, these tools are evaluate the various factors that include indication, doses, drug-drug interaction, and duplication, and to identifying the potential problem related to the polypharmacy. The next one is patients interview, engaging in an open and thorough discussion with the patients about their medication use, including OTC drugs and the herbal supplements they are using, that can provide a valuable insight into their medication regimen and further helps to identifying the polypharmacy related problems. Next is medication management technology. In this domain, we can use technology such as electronic health records, EHRs, and computerized decision support system, and that can further aid in identifying a potential polypharmacy problems. So these are some detection. Again, the medication reconciliation technique is very, very important. Reconciliation process involves comparing the patient's current medication list with their previous medication history, because of we can avoid or we can avoid or eliminate, we can say, the drug therapy which has already been prescribed to the patient, unnecessary drugs. So these are some techniques to detect the polypharmacy related problems. And now the very interesting part came, that is overcome from the polypharmacy. How can we overcome? So the very first technique that we can use, that is medication review and the simplification. Very, very important, simplification. So conduct a medication review with the patient's healthcare provider or a pharmacist to assess the necessity, effectiveness, and the safety of each medication. Consider the discontinuing medication that are no longer needed or have the limited benefits. That is known as simplification. The second is deprescribing. That involves the deliberate reduction or discontinuation of medication that may longer be necessary or may pose some more harm than the benefits. Third thing we can do, that is medical reconciliation. Again, now I think it is the clear reconciliation, that is checking the previous medication history of the patient and comparing with the present one. Communication and collaboration, that is foster effective communication and collaboration among healthcare providers, that including physician, pharmacist, and other healthcare members. Patient education and empowerment, again, it is very, very important to educate patient and caregivers about their medication, including the purpose of medicine, potential side effects of it, and proper administration. And the last is the collaboration management, collaborative medical management, that is medication management. So engage pharmacists to play an active role in the medication management. They can do a better things. Pharmacists can provide medication counseling, conduct medication reviews, and identifying the drug-drug interaction, and provide some suggestions and interventions to optimize the medication regimen further. So these are some overcomes from the polypharmacy, and I'm sure that as healthcare professionals, we healthcare professionals can do it. Let's understand how the overuse and underuse are going to affect the drug-related problems. Overuse meaning, we can, as its name suggests, we can understand that thing, excessively or insufficiently prescribed drugs, leading to potential health risk. And the underuse might further leading to suboptimal therapeutic outcomes, which are not sufficient. So the one over the one hand, we have the overuse of medication. On the other hand, we have an underuse of medication. We'll try to relate both of the things. So see, on the overuse of medication, that can be possible that excessive prescribing might take place. That is, healthcare providers may prescribe medication unnecessarily or in the higher doses than required one, right? Second is the inappropriate self-medication. Patient may misuse the over-the-counter medication or use prescription medications without appropriate medical guidance. That is inappropriate self-medication. Prolonged continuation. Prolonged continuation further include continuing medication beyond the recommended duration without medical indication, and that can further leads to a number of complications. Duplication of the drug. Taking multiple medication with the similar therapeutic effect or active ingredient further leads the overuse of the drug, and that is synergist effect and super synergist effect. Non-adherence, that is, we can say prescribed regimens. In some cases, patient may unintentionally or deliberately overuse the medication by taking dose more
Dr.
frequently.
Neha, again, I'm sorry to disturb you, but people are messaging me if ma'am can go a little slow.
Okay, sir, no worries. Okay, let's understand in detail about overuse of medication. Overuse meaning excessive and insufficiently prescribed drugs. And the very first thing in that, excessive prescribing. That is, healthcare providers may prescribe medication, unnecessarily or in the higher dose than it's required. The second one is inappropriate self-medication. Patient may misuse the OTC drugs to use prescription medication without appropriate medical guidance. Prolonged continuation, that is suggesting the patient are doing self-diagnosis and self-continuation of the drug for the longer period of time. Duplication is multiple medication with similar therapeutic effects are receiving by the patient itself, further leading to a number of complications. And non-adherence, that is, in some cases, patients may unintentionally or deliberately overuse medication by taking dose more frequently or in higher amounts than prescribed one. So believing it like it will enhance the treatment's effectiveness, right? So that is all over overuse of medication. I think there is understandable words: excessive prescribing, inappropriate self-medication, prolonged continuation, duplication, and non-adherence. On the second hand, we can have underuse of medication. That also leads to the failure of therapy. We cannot achieve the optimal therapeutic our goal because of the lower dose. So that is the one thing. Second is the, again, non-adherence happens, and non-compliance, we can say. Patient may not adhere to their prescribed medication regimen either intentionally or unintentionally by skipping the doses, not taking medication as directed, or prematurely discontinuation of therapy. That is underuse of medication. The third one is lack of access or affordability. That is also the reason for underuse. Why? Because limited access to the healthcare service, medications, or health insurance coverage can further, prevent the patients from obtaining and using necessary medication. Lack of access or the affordability. And the fourth, that is patient reluctance, or we can say skepticism. Some patients may have concerns, doubts, and misconception about their own medication, leading to their underuse, or we can say avoidance of the use. So that is all about overuse and underuse of medication. See, what kind of problems we can face with overuse and underuse of drug. There are a number of problems that can be occur when the overuse or underuse of drug can be done. The very first problem we can identify, that is inadequate treatment. Underuse of the medication can result in this thing, inadequate treatment of the health condition, and it may lead to the suboptimal symptom management, or we can say delayed some recovery or progression of disease. Now, failure to take prescribed medication as directed, that can prevent further the desired therapeutic effects and hinder the achievement of the treatment goals. That is inadequate treatment. And the second is worsening of symptoms, or we can say disease progression. When medications are underused, symptoms may persist or may worsen. The third is increased healthcare utilization. Underuse of medication can result in increased healthcare utilization, including more frequent doctor visit, more frequent hospitalization, more emergency room visit, etc. Decreased patient satisfaction. When the medications are underused, patient may experience dissatisfaction with their own treatment because they are not getting recovered. So this can result in decreased patient engagement. The fifth one is the adverse health outcomes. The underuse of medication can increase the risk of adverse health outcomes. Without appropriate medication therapy, the management of chronic disease, further infections may be compromised, and chronic disease may be compromised, and leading to the complications, disease acceleration, and poor prognosis. Next is increased healthcare cost. We already discussed that increased healthcare utilization, further it can lead to increasing cost, overall cost of the health, and medication resistance also occur for the overuse of medication, particularly antibiotics, that can contribute to the development of medication resistance. So when the medications are overused or used inappropriately, microorganisms can become resistant and making infections more challenging to treat. Next is adverse drug reaction. Obviously, the more drug, the more adverse reaction, more chances to get the adverse drug reaction. Next is dependency and addiction. Overuse of certain medications, especially those with additive properties, that can lead to dependency and the addiction as well. And the last is the waste of resources. So overuse of medication can result in the unnecessary consumption of healthcare resource. And this includes the unnecessary prescribing, dispensing, and administration of medications that are not warranted, or we can say appropriate for a given condition. So to mitigate the problem associated with overuse and underuse of medication, it is crucial to promote appropriate prescribing practice, patient education, and adherence to the treatment plans. Let's see some detection technique, how we can detect the overuse and underuse of medicine. The very first we can do is the clinical assessment. The fully, thoroughly the clinical assessment we can do. So conduct a thorough clinical assessment considering patient's symptoms, condition progression, and the response to the treatment. Look for the sign of the underuse and look for the signs of the overuse, what is happening. That is clinical assessment. Second is the prescription pattern analysis. So analyze prescribing patterns and review the medication history. Look for the instances where multiple prescribers are involved, excessive or frequent prescription refills occurs. So that is prescription pattern analysis. We as a PharmD, we are doing it on a daily basis. Even as the healthcare professionals, we are doing it on a daily basis. That is a prescription analysis, right? So that we can do for detection. Pharmacy record. Collaborate with the pharmacist and review the pharmacy record for any type of indication of overuse and underuse. Fourth one we can use, that is non-adherence indicators. Non-adherence indicator, that is signs of the non-adherence to the medication regimen. Either the patient is taking the medication as directed or not. Either the patient is taking tablets as directed or not. That is non-adherence indicators. Patient's feedback and the communication is very, very important. Encourage patient to share their experience and concerns about their medication use. Discuss any barriers or challenges they may face in the adhering to the prescribed regimen. And another, patient self-reporting also, that is also the one of the tool to detect. Encourage patient to provide accurate information about their medication use during medical consultation with the pharmacist. And the monitoring system we can generate, like implementing medication monitoring system such as electronic health records or prescription drug monitoring programs, or tracking the utilization and identifying patterns of the overuse and the underuse. So that is the whole collaborative approach we can do for the detection of overuse and underuse of medication. Let's see some overcomes from the overuse and underuse of medication, how we can overcome it. So overcoming of the any challenges, and particularly for overuse and underuse, that requires a multifaceted, we can say multifaceted approach that involves education, communication, and close collaboration between patient and the healthcare providers. And here are some strategies to help overcoming these issues. The very first is clear communication with the healthcare providers. Encourage open and honest communication with the patient. You have personalized medication plan. So, some doctors are having practice to same prescription chart followed to all the patients. So, personalized medication plan is very, very important. Tailor the medication regimen to each patient specific need. Consider their medical condition, preferences, and lifestyle factors also. Next is simplifying medication management. You can always simplify the prescription. Support patient in managing their medication effectively. Provide some tools such as pill organizers, reminder apps, or medical calendars to them to, avoidance of medication non-adherence. Regular medication reviews is another tool we can use to overcome. And adherence support programs we can do for the awareness, right? That addressing the barriers to the adherence. And the last, that is patient education and empowerment, that is common. So as we see that overcoming the issue requires a partnership between the patient and the healthcare providers, just like the shaking hands. So that is the collaborative approach. No one person cannot do the whole drug-related problem solution. That is a collaborative approach. Let's see, that is a very popular drug-related problem, that is adverse drug reaction, right? ADR stand for the adverse drug reaction, and that refers to any harmful or unintended response to the medication that occurs at the doses that is commonly used for the therapeutic purpose. And ADR can manifest in the various ways and affect different body systems. Okay, for example, GI reactions, allergic reactions, respiratory reaction, CNS reactions, dermat reaction, hepatic reactions, etc. So here are the some points to discuss. That it is important to note that not all the reactions are considered as ADR. Some predictable side effects like drowsiness with sedative drugs are known and mentioned in the label. Also, ADR refers to specifically unintended and harmful reactions, right? So reporting ADR is a crucial part for the pharmacovigilance, as we all agree to that thing, and patient safety also. Healthcare professionals, patient, and the caregivers can report to their country's relevant authorities, and this help to monitor the medication safety, identify potential risk, and take the appropriate action to prevent the harm from the medication. I request you all to watch a 1-minute video to see that what the ADR reporting can bring a change. Safer, right? Reporting that makes medicine safer. So that is the importance of ADR reporting. Now we can see that what kind of problems with adverse drug reactions can take place as a drug related problem. Very first, patient safety is compromised, right? ADR can cause harm to the patient, ranging from, we can say, mild discomfort to severe or even life-threatening reaction. So patient safety is compromised when ADRs are not promptly identified, managed, or prevented, or even not reported. Second is treatment disruption. So ADR may, lead to the discontinuation of, or we can say adjustment of medication, that further leading to disruptions in the treatment plan. The third is increased healthcare cost. ADR can result in additional healthcare utilization, such as emergency department visit, hospitalization, or consultation with the healthcare providers, may leading to increased healthcare cost. Medication non-adherence, as ADR can contribute to the non-adherence where patient may be reluctant to continue taking medications due to adverse effect. Reduced health-related quality of life. ADR significantly impact a patient's quality of life. We can say health-related quality of life, causing physical discomfort, emotional distress, or limitation in the daily activities. And the foremost, that is pharmacovigilance challenges. Detecting and monitoring ADR can be challenging due to underreporting, limited awareness, and the lack of standardized reporting system. So these challenges can further, we can identify it as an emerging safety concerns, or we can say rare ADRs. To address ADR related problems, several strategies also we can use. For example, enhancing pharmacovigilance efforts to encourage reporting and surveillance. We can do some awareness programs to reporting ADR, how to report, where to report, etc. So these are some problems daily life where the healthcare professionals are facing. How we can detect the problems which is associated with ADR? The very first is spontaneous reporting. So healthcare professional, patients, or the caregivers voluntarily report a suspected ADR to the regulatory authorities, and then continue reviewing of that report and that database. We identified the potential adverse drug reaction. Electronic health records, again, that contain a comprehensive patient information, including medication history and some reported symptoms. So analyzing further electronic health records can help to identifying potential ADRs. The third one, that is pharmacovigilance database. There are some database available. For example, national and international pharmacovigilance database collect and store information on reported ADRs. For example, US FDA adverse event reporting system, or WHO global individual case safety reporting system. So that are some pharmacovigilance database which are always in the in a stage of helping that identifying ADR before it is happening. Clinical trials. ADRs are closely monitored during clinical trials, which further involve control testing of medication in a specific population. It is also one of the major tool. Data mining and signal detection, again, very, very important for the detection of ADR. Advanced statistical and data mining techniques that can be applied to the larger healthcare database to identifying some potential associations between medications and adverse events. And this method help further to detect signals or patterns that may indicate previously unknown ADRs. So that is very important, data mining and signal detection. The next is pharmacist and healthcare professionals reporting. Again, we can make a record of pharmacists and healthcare professionals reporting ADRs and utilize it. Adverse event monitoring programs we can do. Some healthcare institution or organizations have proactively established that programs to monitor the patients for adverse drug reactions. And it is important to note that detecting ADR is an ongoing process, and multiple methods are often combined to improve the accuracy and the comprehensiveness of ADR detection. Let's see some overcome from that ADR related problems. Overcoming ADR is completely depend on the specific response and the severity. And here are some strategies that can be in, that can help in the managing and overcoming ADRs. Very first is the discontinuation or adjustment of medication. Sometimes the healthcare professional provides may discontinue the medication. They provide the medication and further do the discontinuation, that is de-challenging because of the adverse drug reaction, and adjust the doses also. So this may involve further discontinuation and adjustment of medication. Symptomatic treatment, we can always do symptomatic treatment, meaning that can help to alleviate the discomfort or manage the side effect of the specific ADRs. For example, if you experience nausea or vomiting, the medications to relieve these symptoms may be prescribed simultaneously, right? The next is medication reconciliation, ensuring the previous medication history and comparing it with the present one. Another thing we can use, that is allergy and sensitivity testing. So if the ADR is suspected of an allergic reaction, allergy testing may be conducted to confirm the specific allergen, and future complication we can avoid further on behalf of that sensitivity testing. Patient education is essential to be aware of potential ADRs which is associated with your medicine. Educate yourself and the patient about the common side effects, and patient education is must. And the last is the medication monitoring and the follow-up. Continue reviewing the medication and continue taking follow-up that may further reduce the adverse drug reaction rate. And every situation is unique, and the appropriate step to overcoming that ADR that will be vary according to the situation itself. So working closely with your healthcare provider to discuss your case, receiving personalized advice and make informed decision about your medication regimen is crucial part. Let's see how drug-drug interaction as a drug-related problem work. We all know that there are three types of drug interaction: drug food, drug interaction, drug food interaction, and the drug disease interaction. Let's see one by one. The first one, that is drug interaction, and the another two respectively, that is drug food and the drug disease interaction. Now here comes the fun part, that you have to remember the color code, which I mentioned: the green for the drug, the pink for the drug food, and the yellow is for drug disease. As in my book, I covered that three chapters in a very separate way, but because of the lack of PPT slides and lack of discussion part, I use this color code. So you have to just remember the green, pink, and yellow code for the upcoming problems detection and the overcomes part. Let's see some problems related to drug first. Green part, that is reduce efficacy. Again, if the drug interactions are there, it may reduce the efficacy, it may increase some toxicity level, it alters the pharmacokinetics by interacting with each one another. Polypharmacy burden, it may further increase, and compliance issues also it can possible, right? With the drug food, that is altered drug absorption. Food may interact with the drug and leading to decreasing absorption. That is variable drug level in the blood. Increased drug toxicity. Nutrient interaction. We all know that the grape juice is having interaction. Milk is having interaction with the another agents. That is nutrient interaction. And some dietary restrictions are also there in the drug food interaction. The last, that is drug disease. What happens when the drug disease interaction happens? So if the patient is suffering from any kidney disease and you are giving such drugs which are having excreted from the kidney itself, it might leading to some disease pathway alteration and further leading to drug disease interaction. So that is reduce efficacy, increase risk of adverse drug reaction, compromise safety, complex medication regimen further, and then drug interaction with the disease specific pathway, as I said earlier. So these all are the problems with the drug interaction. The very first row is the drug, the second pink, that is drug food, and the yellow, that is drug disease interaction. And these are some problems which are associated with it. Let's see how we can detection of the drug interaction. So the detection of drug interaction, it is always a critical aspect of medication management and the patient safety. Let's see, very first is the drug interaction database we can use. Okay, drug interaction database are the various comprehensive drug interaction compilation, and we can use further to check. The second we can use, that is pharmacokinetic principles. So understanding the kinetic principle of medication, that can help to predict and detect the potential drug interaction further. Clinical guidelines we can follow. Clinical guidelines means professional societies, regulatory agencies, and organizations often publish some clinical guidelines that highlight further specific drug interaction of clinical significance. We can always follow that thing as a detection part. Computerized decision support system, we can make some electronic health records, and clinical decision supportive software often include some drug interaction modules that can alter further healthcare professional to potential interaction, okay, to identifying some potential interaction. So that is computerized. Obviously, we are having a technology nowadays. We can use some modules, some softwares. And adverse event monitoring. So monitoring ADR and drug interaction, that can also further helping in the detection. So that is a drug interaction detection part. The second is drug food. How can we detect the drug food? So for the drug food, you have to check the drug information sources. That is, utilize a comprehensive drug information sources such as drug monographs, package inserts, or reputable organizable databases, and the sources often include information on potential drug food interactions. Next we can use, that is drug interaction database. That is also suggesting some drug food. Professional guidelines we can use for drug food. Patient self-reported information also we can use. Sometimes what happen, unknown drug interaction, patient self-reporting information suggests that if I take that medication with the milk, it leading to itchiness. So that is self-reporting, okay? And some professional guidelines we can follow. And for The last, that is drug disease, medical history of the patient is very, very important. If the patient is suffering from any kind of medical history, that is very important. Drug information resources we have to follow. Clinical practice guideline we have to follow. Kinetic and dynamic consideration of very, very important. And drug interaction database we can follow for the drug disease. But healthcare professionals must be aware of available tools and resources and how to use. That is very important for this type of interaction check. Let's see how we can overcome it. Overcome from the drug interaction. Okay, from overcoming from the DDIs, that is drug-drug interaction, that requires further proactive approach to the medication management. That include, again on a green side, that is drug-drug interaction, right? Medication review. So conduct a review of a patient's medication profile, including a prescription medications, OTC. If the patient is taking any herbal supplements, you have to take that also and identify if there is any drug-drug interaction. Communication and collaboration with the other healthcare professionals if the patient is visiting more than one center. Individualized treatment plan is must. Individualized treatment plan further developed as considered to the patient's unique needs and including the identification of medications, therapeutic goals, and the alternatives. So that is individualized treatment plan. And therapeutic drug monitoring. Okay, that is also very important. Consider TDM for the medications with the narrow therapeutic indexes. Very, very important. And those, those who are having more chances of the drug-drug interaction. Regular medication reviews and stay informed. Stay informed of what the prescription the patient follows. So that is all the overcoming ideas from the drug-drug interaction. For drug food, that is also required a proactive approach to the medication management and making appropriate adjustment to minimize further risk. Very first is patient education is must. Because some patients are assuming by themselves that if they are taking any antibiotic, the milk is compulsory to avoid acidity. No, that is not like that, right? So we have to educate patient that interactions can take place. Medication review, again, reviewing the whole medication chart. Timing of medication administration. Here the timing meaning before meal, after meal, with food, without food, etc. Dietary modification, if any, if the patient is having non-veg more and if the patient is having saturated fatty intake, then you have to suggest some dietary modification. And drug formulation also you should know. Monitoring and doing dose adjustment further and staying informed. So these are some overcoming ideas from drug-food interaction. And next is the drug-disease interaction. That is also and minimizing their impact on the patient's safety. That is also including comprehensive medication review. Second is individualized treatment plan. Close monitoring and follow-up. Here the close monitoring and follow-up include the laboratory follow-up. So we can check that either it is increasing, decreasing, etc. Collaboration among other healthcare providers if the patient is visiting more than one center. Patient education and counseling is very, very important if the patient is suffering from any comorbid condition. So these are some strategies. Regular medication review, use of decision supportive tools, that is health records, etc. And stay updated on current research and current guidelines for the drug disease interaction avoidance. So that is overcomes. So as healthcare professionals, we can do it by implementing these strategies. We as in healthcare professionals proactively identifying and manage the drug-drug interaction or drug food, and ensuring the patient safety and optimizing treatment outcomes further. Let's understand the medication errors. So errors refer to any preventable event. Okay. Medication errors are always a preventable events. That is very important word that leads to inappropriate medication use or harm to a patient. It occurs when there is discrepancies between what the healthcare provider intend to prescribe and what the patient receives or experience. So that is the discrepancies happening in the medication error. And medication error can happen at any stage of the medication process, including prescribing, transcribing, dispensing, nursing, and monitoring. At any stage, medication errors can take place. Medication errors can have various causes also, including communication breakdowns, illegible handwriting, confusion, including similar medication names, sound alike, look alike drug, incorrect dosing calculation, equipment malfunctions, and inadequate patient information. So that can be the cause for the medication errors. And they can result in adverse event ranging from mild side effect to the severe harm or even sometimes death. Let's see how the medication errors can take different forms. At what forms medication errors takes place? Very first is the prescribing errors, right? Prescribing errors meaning we can say these occurs when the healthcare providers make mistakes in prescribing medication. For example, incorrect dose, wrong medication selection, prescribing medications to the patient with known allergy. So these are some prescribing errors. Second is transcription error, meaning these are the some errors that is occurring when the information from the prescription is inaccurately recorded or transferred to a different format, such as electronic health record or a medication administration record. Because of illegible handwriting or misinterpretation happens. For abbreviations, we can say misinterpretation happening because of the abbreviations. So that is transcription errors. The third one is the dispensing errors, meaning pharmacies or in the healthcare facilities when the medications are prepared or packed incorrectly. That is dispensing errors. Next is administration errors. That occurs when the medications are administered to the patient. These errors can result from incorrect doses, wrong route of administration, incorrect timing also. So that is administrative errors. Monitoring errors. That happens when the healthcare provider fails to adequately monitor patient for the effectiveness and the safety of the medication. That is monitoring errors, and it is the error from healthcare provider. Wrong medication. The patient receives a medication different from what is intended. Next is wrong dose. Patient receives a higher or a lower dose of the medication than prescribed. We can see a number of times this happen in the pharmacy store that the wrong dose is given, okay, provided to the patient. Allergic reaction. The patient experiences an adverse reaction due to an allergy or intolerance to the medication. Drug interaction. The patient experiences harmful effects due to interaction between the two drugs. Self-medication omission. The patient misses, or we can say not receive a prescribed medication and omit further by self only. So these are some medication errors can take a different forms. At what forms the medication errors takes place. Now we'll see the problems which are with the medication errors. Medication errors can result in problems that have significant implications for the patient. Let's see one by one. First is patient harm. That is very important. Very at a bigger level that is happening. Patient harm. The primary concern with the medication error is to potential harm they can cause to the patient. So that is the main thing. Errors in prescribing, dispensing, and administering the medication can result in the ADR, toxicity, treatment failure, and the worsening of the patient's condition. So that is the patient harm. Increased healthcare cost. Again, it is connected and it is related to that thing. Legal and ethical consequences. See, medication error can have legal and ethical implications also. For example, patient who experience harm due to medication error may, further telling that legal action against healthcare providers or institution they take because of they are facing some unusual conditions, right? So this can result further in the legal proceedings, financial settlements, or damage to the reputation of healthcare provider or the facility itself. Next is loss of trust and the confidence. Loss of trust and the confidence from patient to on the healthcare facilities. Adverse impact on the healthcare providers. Medication errors can have personal and professional consequences for the healthcare providers which are involved in that thing, and they may experience some emotional distress, guilt, and the professional self-doubt. And again, the systematic challenges that highlight some, within healthcare system, factors such as inadequate communication, flawed medication reconciliation processes, high workload. These are some systematic challenges that can be occurs with the medication error. So as an healthcare professional, to mitigate the problem which is associated with the medication errors, system should focus on implementing strategies to enhance the safety of the all over patient health. Let's see how can we detect the medication error. The very first we can do that is medical reconciliation to check the previous history. The second, very important, computerized physician order entry system we can use, also known as CPOE. That system allows the healthcare provider to enter the medication orders electronically, reducing further the risk of errors which is associated with illegible handwriting or transcribing mistakes, that is abbreviations, etc. So the physician itself having that system and they are entering the whole prescription inside it. So that further it is important. And we can detect from the software itself. We can use some barcode medication administered techniques, that is BCMA. And this system further use barcodes on the medication and patient identification bands, that is to ensure the proper medication is administered to the right patient at the right time. So by scanning the barcode, healthcare providers can verify the medication's correctness before administration and detect the potential errors too. So that is also the tool to detect and overcoming. Automated dispensing system we can generate if the patient is, patient is coming for the repurchasing of the same prescription. Automated dispensing system should be there. Next is clinical decision support system, also known as CDSS. That is also a software that provide healthcare professionals with the real-time clinical guidance, and also that generates alerts on the patient specific data. So this system can flag some potential medication errors such as drug-drug interaction, contradiction, or some dosing errors. So that is also further important. Clinical audit and quality assurance programs. Regular clinical audits and that's QA programs further help in reviewing the medication practice, identifying the improvement areas, and further detect the medication error patterns. So that is detection. Okay, so at one hand, we are having so much ideas like that man is having a bulb on the one hand, and on the another hand, we are having a magnifying that at what stage the medication errors are happening. But it is important to note again that no single method is foolproof. Combination strategy is typically used to detect the medication errors effectively. That is very important. The one tool cannot solve the whole problem associated with the medication error. Let's see how we can overcome it. Overcome from the medication error include the very first thing, that is enhanced communication and collaboration. Improve communication among healthcare providers that were involved in the medication process. Second, implement some technological solutions like we already talked about computerized physician order entry, CPOE, and also we can see some electronic medication administered records and some electronic health records. That is also overcoming ideas. Standardize medication process, develop some protocols, develop some guidelines, okay, and develop some practice for the medication related process. Implement that thing, and then you can make the standardized medication process. Next is improve medication reconciliation process again, and enhance some medication education training programs. Establish culture of safety and reporting. Very, very important. Establishing a culture for safety and reporting. And next is conducting medication reviews and audits. Engage patient in the medication safety. Encourage patient to be, proactive in their own medication safety. Encourage them to ask questions about their medication. Keep an update medication list and inform healthcare providers about all the medications they are taking, including over the counter, including some herbal medicines, etc. And continuous quality improvement. We are focusing on implementing continuous quality improvement that for the overcome, that can be the overcome from the medication error. So that is not the only solution to avoid medication error, but we surely can implement these strategies. Let's see how non-adherence is important as drug-related problems. So I already suggest you that medication non-adherence, you have to understand. Okay, the definition of medication non-adherence refers, that is to, here I already mentioned, that is refers to the failure of patient to take their medication as prescribed by their healthcare providers. Or next is, it occurs when the patient do not follow the recommended dose, frequency, duration of their medication regimen. And non-adherence can include skipping regular doses, taking incorrect doses, taking medications at the wrong time, and prematurely discontinuation medication without medical advice. In country like India, that is the major issue with this thing, that is prematurely discontinuing medication without medical advice. Patients are assuming that they completed the dose and they are good, they are feeling good, and they discontinue by themselves. So that is the biggest challenge to understand, to make them understand. Medication non-adherence is a significant concern in the healthcare. You can see in the left side, one healthcare provider is suggesting that this could help you, but it may have some side effect. But the patient is denied, I understand, but I don't think it is worth it for me. The mutual goal is, our goal is to better health. Okay, so that is the non-adherence concept. Let's understand what problems with the non-adherence might take, right? Very first is suboptimal treatment outcomes. Obviously, if the patient discontinue the therapy before asking to the physician or without seeking any medical advice, we are going to see that the suboptimal therapeutic outcome. Okay. Next is increased healthcare overall cost. Medication non-adherence can increase all over cost. Incomplete or ineffective treatment due to that non-adherence may require some additional medical visit and hospitalization. Worsening the chronic condition, that is also the problem associated with that non-adherence thing. Increase the risk of complication, like medication non-adherence can increase the risk of complication associated with certain conditions. For example, non-adherence to anticoagulant medication in the patient with atrial fibrillation, that can further raise the risk for the stroke and the blood clots, right? So that is increase the risk of complication with the non-adherence. Development of drug resistance. So in case of antibiotics or antiviral medication, non-adherence can contribute to developing drug resistant strains for the bacteria and viruses. And when medications are not taken, consistently, what happens next? Full duration of the treatment, if not taken, then it can allow the survival of the organisms and leading to the treatment failure at the end. Next is impact on the public health. Non-adherence to the medications for infectious disease such as tuberculosis or we can say HIV, that can have public health implications. Incomplete treatment can contribute to the spread of these diseases within the communities, making them harder to control. So that is the non-adherence problem related to impact on the public health, right? So that is very crucial part, as in several factors can contribute to the medication non-adherence, including complex medication regimen, forgetfulness, lack of understanding about the importance of adherence, what is the importance, and concern about the side effect, financial constraints, and the limited social support. So we as in healthcare providers, address these factors through the patient education, some clear communication, simplification of medication regimen, reminders to improve the medication adherence. We should take the initiative. Let's understand how we can detect the non-adherence. So that include patient self-reporting, again directly asking patient about their medication taking behavior that can provide insight into their adherence. You can ask that how do you take the medication, at what time do you take the medication? Okay, that kind of self-reporting. We can say, however, self-reporting may not always be accurate because patient may tell you the lie. Patient may overestimate their adherence to please the healthcare provider or underestimate it due to the forgetfulness or reluctance to admit the non-adherence. So that is not accurate. Second thing we can do for detection, very important, pill count or medication possession ratio, that is MPR, assessing the number of pills which is remaining in medication bottles or calculating the MPR based on refill history, that can help further estimate the adherence. Further, it compares the number of doses which is prescribed to those dispensed over a specific period. So, however, this may help in the further detecting the non-adherence. Next is medication event monitoring system, MEMS. That is also involving using medication containers with electronic caps. Now, that is again on the question mark that in the country like India, the population is very, very high. That is very problematic to introduce this kind of techniques, but we can at least try and we can at least think over it. So that MMSE involves using medication that containers with the electronic cap that further record the date and the time each time the container is open. But again, the problem is the method provides more objective data on when the medication was accessed, but did not confirm the ingestion. So that is MMSE drawback. Pharmacy refill records, we can use monitoring the frequency and the regularity of the medication refills. We can identify for the adherence check. Obviously, we can use biomarker monitoring. Some medication have specific biomarkers which is associated with them. Like if the serious conditions are there, in that thing, you can use some biomarker monitoring techniques, monitoring the level of these biomarkers in the blood and the urine. That can provide, indirect evidence of medication adherence if the patient is taking the medication at the time, at the suggested time, right? Medical reconciliation, always you can do that thing. Digital health technologies you can use, mobile apps, electronic, pill boxes or variable devices equipped with the sensors that can help further to monitor the medical adherence. These technologies, track when the medications are taken and send the reminders to the patient to take the medication and on time. So again, the healthcare provider with the magnifying glass, they can detect the some points for the non-adherence. But it is again important to note that no single method provides a definite medication adherence assessment. Combining multiple approaches and considering the patient context, clinical history, and the individual circumstances that can help further healthcare providers to better understand the medication adherence behavior. Let's see how we can overcome from the non-adherence. First, very important, patient education. Provide a clear and comprehensive information as an healthcare provider about the importance of medication adherence, including the purpose of each medication, expected benefit, and potential risk of the non-adherence. If they are not taking medication regularly, what can be possible side effect, right? Educate them. Simplify the medication regimen. Complex dosing schedules can contribute to the non-adherence. Simplify the regimen by consolidating, doses, reducing the number of medication, or we can say adjusting some doses frequency whenever it is possible. So that is again important. Clear instructions. Provide written instructions and verbal explanation about how to take medication correctly. Medication reminders. Encourage patient to use reminders in the mobile apps such as smartphone alarms, pill boxes, or medication reminder apps to help them remember to take their medications on time. Now, next is tailor some medication plans to individualized need. Consider patient's lifestyles, preferences, and challenges when developing medication plan. That will further help. Then address some cost concerns. It will help again. Okay, that is the very good tool to use against the non-adherence. Discuss potential financial barriers to medication adherence with the patient. Explore options such as generic alternatives, patient assistant programs, or cost saving strategies you can go with. Regular follow-up and enhancing communication, again very important, and address some side effects and concerns associated with the medication chart. So by doing this thing, overcoming from that thing, and we can overcome from the non-adherence. Remember, everyone's circumstances and reasons for non-adherence may vary. So we have to check that individualized, we can say a customized plan we have to follow for the patient and to avoid the non-adherence, medication non-adherence. Now that is the end of our topic discussion, and there are some another drug related problems are there. Just for example, we can say overuse leading to toxicity, abuse, addiction. We can do some separate discussion on abuse and addiction, right? Or we can say inappropriate medication use also, again the major drug related problem nowadays. It is all covered under the book that I have published. I request you all to check the book. And this is the title page, drug related problems and their overcomes. That are 100-page book. This is the front look of the book. This is the author description and this is the price. And the book is available on the Amazon and Flipkart. You can use whatever in whatever stage you needed that thing, that drug related problems and their overcomes. Thank you so much for the time.
So thank you very much, guys. Thank you very much, Neha, for this wonderful webinar. Or I'll say you have covered the entire topic. You have covered the entire things, whatever you have written in the book, and it was must learn for all the pharmacies, all the pharmacy professionals, all the people who are working in the hospital, as you have covered from the medication error, medication adherence, and a lot of things what should be covered, and this was amazing. Okay, so I'm really grateful to have you on board. And before we go to the further comments, I would like to ask, because we have Professor Mahadev Bhatt sir from USA. He has joined us for this webinar, and he's always there in the wonderful things. So, sir, you're welcome, and you can unmute and you can share your experiences from the USA. How you have felt it. He has worked in USA as a clinical pharmacist for more than 35 years.
Hello, Ajit. How are you doing?
I'm doing good, sir. Wonderful. Thank you.
Let me congratulate Neha.
Thank you so much, sir.
Absolutely.
She's such a tiny girl, and she's such a pretty girl, and she has written such a big book.
Yep, absolutely.
Congratulations.
My first try.
And Neha, say hi to Tarun Tak. I think he works for your college.
Yes.
And also give my regards to Dr. L.D. Patel. I think he's in charge of your postgraduate course.
Yes, sir.
I think he passed in 75 and I passed in 1972. Okay. What this tells me that there is a great opportunity. Like Ajit has got a niche, after he got graduated, he started this education system. So a lot of people got benefited. But there is a lot of money to be made when the patients are discharged from the hospital. Everybody doesn't have to be in the hospital to take advantage of Farm D. This is beyond that. It comes under pharmaceutical services. There is the book, what she was going through, I think she has referred to a lot of Australian material and a lot of material from London, because some of the languages I see that it's from there, and it's a very great attempt. A PharmD student can set up a service where they can monitor the patients and the hospital can send them to that. You cannot treat everybody, but you have to make a chance. Ajit made it a point that I would like to teach students to have some another aspects of higher education, to do the clinical trials, and look what happened today. How greatly he has helped India to come forward. I think Dr. Neha mentioned about ADR.
Absolutely.
Ajit, I always wonder, one thing. There's a thing called point of dispensing, POD.
Yes, true.
The ADR doesn't have to happen when people go to the hospital. How many hospitals are in India? And how many patients are there? And what is our population? 1.4 billion almost. 140 crore bolte hain.
Right, sir.
They also need your help. I like what she mentioned about the grapefruit. See, my expertise is in practical solutions. Generally, what I talk, and I think Ajit knows that how to avoid a drug interaction, how to avoid a ADR. ADR is something like a adverse drug event. I don't know, you guys know about the drug Vioxx, VIOXX. It is being off the market from Merck Sharp and Dohme. And I was invited by the judge in Arizona to give an expert witness. I think Neha mentioned one very good thing, that read the leaflets, And I was asked to say in a layman's term that why this drug was not good. And I said, look at the leaflet. It was compared against Ajit 250 milligram of naproxen, saying that it does a lot better work than that. So all the researchers, they wanted to have another NSAID on the market to do that. Now, when you take a medication and hoping that it will help the smooth muscles, but once the medication goes inside, it doesn't know it works on the heart or it works on the foot or it works on the neck or what it is. There are a lot of smooth muscles.
Absolutely.
And Ajit is an expert. I tell him a heart doctor, look at the calcium channel blockers, amlodipine. It relaxes the smooth muscles, so the blood flow is more into the arteries. So you are redistributing the volume of blood, so your blood pressure is lower. But the same thing can happen into the sphincter valve of the stomach. And I can bet you 10-1 that if a patient is taking amlodipine, within 3 months, if they are taking 10 milligram, they will have a gastritis. But generally in India, you are not going to find gastritis because everybody takes pantoprazole over the counter or omeprazole. Now imagine that if people are taking that and then doctor asks them to take the enteric cortic aspirin, where is it going to open up?
True.
So
Absolutely.
this book, I think you guys should read it and understand it. And I'm quite sure Ajit will find a way to set up a center where you can enroll the patients and people will pay you money. Suppose each one pay 1,000 rupees a month, you can advise them and you can maintain their medications,
Absolutely.
And since Neha ji is from Parul University, I think few months back, I gave a lecture at the Parul University, they can establish something called, I think both of you should be familiar, MAC, Medicine Assessment Center. In Australia, everybody has got it. And also, every pharmacy college in America has got a MAC. So what happens is that people bring in the medication, what they are taking, and they have got an open communication with the pharmacist. Now, it doesn't have to be a registered pharmacist. It can be a pharmacy students. If a students can understand what to ask and what not to ask, and then apply it,
True.
Like suppose somebody is a PhD or he has that M.Pharm with, some of the courses Ajit is, saying about diabetes and blood pressure and things like that. There are a lot of small things you can figure out and you can tell patient what to do. I do understand that pharmacists would like to prescribe, there's a big thing going on, but de-prescribing is also an art.
Yes.
You get older, you need less medication because body cannot handle certain things. I'm 75-year-old and I'll give you just one more minute. I went to a dentist day before yesterday. My grandchildren said that, Grandpa, you are going to use our dentist. I said, okay, sure, let's go to him. I had a little bit of bleeding in the back because when I gargle in the morning, so I started using Peridex, chlorhexidine and betadine gargle, and she told me that I should take some antibiotic for 10 days.
Oh.
I said, okay. So I said, what would you like me to take? And I said, I have got some augmenting at home, So, oh, that will be fine. I said, how many days? She says, 10 days. So I said, why? Amoxicillin and erythromycin 500, one tablet, 4 times a day for 10 days. We have got a joke here, that if it's a dentist prescription, it is always 4 times a day. It is always for 10 days. And last sentence is UG, until gone. And sometimes they use Caflex because if it is a puncture wound, it's a different thing, So I said, are you sure you want me to take it? Now my grandson was with me, so I didn't want to embarrass the doctor, but I said, okay, I will see you in 2 weeks. She was a very nice and kind lady, but sometimes there are certain limitations. Like we have our limitations. Polypharmacy is nothing but India. Okay. Why everybody is putting ADR right now? And I think Ajit should know that World Health Organization cited India because the reporting of ADR was 0.002%, where there is a 140 crore, every time Modi says that.
Absolutely.
So now some smart guy, who wants to increase that amount. But side effects can be managed, ADR can be managed, but how to avoid them? The duty of a pharmacist is to stop unnecessary hospital admission, so the people can have a better health. Ajit, thank you for the great program.
Thank you,
Neha,
sir. Thank you for joining.
Back to you. And I'm glad, if possible, send me your email address,
Sure, sir.
Ajit has got
Will
my
say, sir.
WhatsApp number,
Say, sir.
and be good. There are a lot of things, good things are going to happen in Baroda,
Yes, sir.
you know.
Thank you so much, sir.
And
Thank
I'm
you.
really thankful to have you, sir. After a long time, I'm hearing you. Very glad and very happy to see you, sir.
Thank you. Thank you so much.
Thank you very much.
Namaskar, everybody.
Namaste, sir. So,
Make
everyone,
some money, guys. Make some money and have a shop, just like
yes,
Ajit has got it. Have a system where you can have patients referred to you from the hospitals. You know, and imagine that you have got 500 patients or 100 patients, 1,000 rupees a month. There is no inventories involved, and you can help, and you will have a lot of blessings.
I
I
always,
know a. Go ahead.
please go ahead, sir. Please go ahead.
I know a person in Ahmedabad, not in Baroda. They had a difficult delivery. So the in-laws had come from Bhavnagar to Baroda, and the guy had a love marriage. So somehow or other, he didn't go well. So the parents went back, and they were my related. So I told them, I said, we can hire a service because the lady had to lay down, for 3 or 4 months and do less work. And I said, we can hire a cook. I think in Baroda, there is a system that they charge around 25 to 30,000 rupees a month, and they take care of it. Why can't we do that?
Do that.
Pharmacist, Farm D, come on, guys. Go and hire a midwife, who can go there, manage their medication, and you charge them extra. There are people in Baroda who can pay 25,000 rupees a month. Well, of course, this person, they were in my relation, so they didn't have to worry about the money, because I helped them out a little bit, But in Baroda, anything can happen. And if you start a medicine assessment center at a college, and with Ajit's help, he has got wonders, and we can treat a lot of people. Thank you so much for
Thank you,
letting
sir.
me talk for a few minutes.
Thank you, sir.
And good luck to Nehaji.
Thank you
Thank you,
so much,
sir.
sir.
And I always encourage my students as well because I interact with thousands of the students every week. I always interact them to go for the pharmaceutical care centers. But I don't know what's the trend in India. They want to go for MD. They want to treat the patients directly. Very sad to hear, but a different scenario. But guys, please look at that. What's exactly sir has said here and described very nicely. Okay, so you must learn something from the experience, right? So nice to have you guys. If you have any questions to Dr. Neha, please ask. You can
Yes.
write your questions and we'll have a question answer session for next 5 minutes. Thank you guys for the wonderful feedbacks here.
Sir, I want to say that thank you so much for uh, providing me the opportunity to share my book with all of
Come
you,
on.
because
I must thank you
it is a big
because
thing for me. And it is my first attempt for the book, for the webinar, and it is great.
it was wonderful. It was really wonderful, and I believe that you have covered a lot of things, and I was supposed to teach my students, and you have covered a lot of my part, and I'm happy that you saved my at least 2 to 3 hours now. Emergency eyes, people. I'm so sorry. Okay, guys. So thank you, guys. Okay, someone has one question. Stop and start or Beers criteria. Okay.
Which is more effective in screening polypharmacy, stop, starts, or Beer's criteria is more effective, I guess.
More effective. Absolutely, yes.
Because that is the only thing we can assess for the older patient, that what kind of medication we can prescribe and we can deliver or not. So Beer's criteria is the answer.
Oh, there's one more question. From your perspective, what's the biggest drug problem in India, Neha?
Polypharmacy is the biggest problem, as sirs already said that thing, that
Yes.
that is the biggest problem in the India. As we are sitting in the DIC, we are observing that thing.
Yes, absolutely.
Biggest DRP and
अगर
ADR.
जाओगे बुखार के लिए तो लेके आओगे 5 टैबलेट साथ में, because see the people here are they're not aware of the exact thing and they don't want to diagnose the thing, so they are like चलो एंटी फंगल भी दे दो, एंटी बैक्टीरियल भी दे दो, एंटी वायरल भी दे दो, सारी एक साथ दे दो, कुछ ना कुछ तो काम
Multivitamins are
करेगा ही
also
करेगा.
frequently prescribed.
Yeah, so कुछ ना कुछ तो काम करेगा ही. The people think like that. These so no comments on that, guys, because If we comment also, nothing is going to change.
Sir, one question is there. Is there any scope of PharmD in India?
I'm going to take one wonderful webinar very soon on this, guys.
What is the
I'm,
opportunity PharmD
yes,
people in India?
I'm coming up with one interview session with my team only. So my team has arranged my interview. Very soon it will be coming. And you guys must join to break your myths. You have a lot of myths. I get a lot of questions.
Right. India is the biggest like hub. Like अभी तो इंडिया में सबसे ज्यादा opportunities बनने वाली है. If you have the
Best
capability,
ekdam, India is the best
you
place
can
for the
do
foundries right
whatever.
now.
Yes, you can do wonders if you have capabilities either
Absolutely.
in India, either in abroad.
See,
Doesn't
learn from the mentors. I call all the mentors who are expert, and they have the expertise in a specific part. See, look at Neha. Literally, I was surprised when I looked at her post. Immediate after 5 seconds, I messaged her, "Would you like to take a session for my students?" Because I want to set the examples for you guys. Literally, you should learn, do something, write the
it
book, write the
takes
papers, write something, write the blogs, okay, and make the people aware about the career, about the antibiotics, about the medicines, about the errors, about whatever you want. You literally, guys, I always say that you must have heard many times, but again I'll repeat it. You are the first generation of PharmD in India. If you are not doing it, nobody will do it. You have to set the examples for your upcoming generations. Okay,
precisely.
so you have to do it. Nobody will come up with a thali of the careers or thali of the things for you to we just can guide you. We are doing our best, we can guide you. You also do something. You just come up with a lot of career options are there. Okay, just come to the entrepreneurship, come to the hospitals, come to the pharmaceutical care centers. Why you're running after MD, I have no idea.
Oh, I don't understand precisely. But I would like to share that I started the book writing in the internship, and it takes more than
See,
1.5 year for
yeah,
100-page book. So
yes. Absolutely, it's really
rejection
appreciable,
acceptance.
appreciable. And after listening to you, Neha, for 1 hour, I can certainly say that book is wonderful. Okay, I did not read yet because I think we have connected on Sunday only. So I'm going to read it. And guys, as you have seen, you were asking for the PPTs. I'm suggesting not to give the PPTs at all to anyone because they have to read the book and with the description. Full descriptive, things are there in the book. Okay. Yes.
Neha, can you do me one favor?
Yes, sir.
Whatever patients you are looking at it, make some kind of a data collection with the diagnosis versus the medication versus the patient's age and habit.
Okay.
And it always helps, and when you let the student know that this is what I have done, uh, I have never given a lecture if I have not done that thing practically. Like Ajit had given some examples one time about blood pressure. I think his brother-in-law had it, and it makes a different effect. And you are the person who has got a chance to do that data collection. And if Baroda can do it, Baroda is a very progressive country in Gujarat, like everybody had a dream, go to Baroda and go to, see what it is. And of course, Manipal, I love it. I was in Manipal between 68 and 1970, So now we have got a junior Ajit in a different form.
True, sir.
Thank
True,
you
sir.
so much. And
Yes,
Ajit, thank you. And I'm going to sign off now. Okay.
Thank you, sir.
Thank you
Thank you.
so much.
Please take care, sir. Yes.
Namaskar.
Namaste, sir.
Namaskar.
So I have some questions here. We are not talking about jobs right now, and we are not talking about MD right now. We'll take it in the next class. Okay. Can you please organize the right webinar on writing the textbook? Is it possible? Of course, it's possible. We have the authors with us. Okay. Can you? Okay, fine. This one question very important. Very nice question was there. Where is that? Oh, someone is writing 1.5 year to write a book. Do you think it's a one-day work, guys?
You
It
can try
needs.
to write one paragraph, you will understand.
it needs the consistency and the continuous research and readings, lot of updated readings from different countries, different societies, different scientific papers, new research, old research. How to get into the research centers, I'll tell you in the next class that I'm coming up with. Okay, I think you people failed to address all the doubts. Okay, very nice. Thank you for this comment. I think you did not attend the entire class. Ramalingeshwara Rao, I'm sorry to say that, but I'll take it positively. Can you share the book? Book is there in the, see, the same title, what you are, covering now in this webinar is the book's title. Okay. Okay, Neha, some question is there. Can you explain the spontaneous reporting? Mohit Nair is asking this question.
But I'm not able to see that question.
No, that's okay. I can read it to you. Ma'am, can you explain spontaneous reporting?
Spontaneous reporting, we can check as in detection part of the errors or the drug related problems that are occurring. The patient, or we can say online, some platforms are also available to report the problems the person face after having the drug. So that can be the spontaneous reporting part. There are some another categories of the spontaneous reporting, but the one format that is online. Also, the person can fill the form and for the reporting and go to the nearest vigilance center and submit it for that is also the spontaneous reporting. So we can go through that spontaneous reporting database and we can go through that. If they are doing some handwritten work, then we can check that thing also for detection part as a drug related problems, and then we'll overcome that thing. So that is spontaneous reporting working, or we can say helping to detect.
Okay, so one more question is there. Are there any ideas to reduce the polypharmacy in multiple problems?
Polypharmacy can lead to multiple problems, rightly said. And there, I already covered that what kind of overcomes we can do for avoidance of polypharmacy. We have to do a continuous medication review. First of all, we'll have to have that idea that this is the thing which is completely needed and these are some unnecessary drugs. So first of all, we as an healthcare professional should develop some strong base of pharmacokinetic dynamics and as well as some strong therapeutic base of us, and then we'll suggest someone to eliminate or to add the drug itself. So I think we as in clinical pharmacists can do and play a major role in avoidance of polypharmacy problems by doing some analysis, by letting the doctors know that this is not necessary and that is unnecessarily prescribed and everything. Polypharmacy is the biggest challenge to face, and
Absolutely.
it is not easy at all to overcome that thing. But always we can try our best.
Absolutely. What is the assessment for pediatric population? If you would like to give some idea on that, Dr. Deepika Gopinath has asked this question.
Sorry, sir, what?
What is the assessment for pediatric population? In the pediatric
Assessment for pediatric population.
Yeah, maybe for the drug-related problems. Yes.
For drug-related problems, see, the doses calculation for pediatric is completely different. If you visit some pediatric ward, you will find some dose calculation book. You can have it and you can, thoroughly go through it, what kind of dose adjustment pediatric patient should follow. And then you can identify some drug-related problems with the pediatric population. See, that is some specific population like pediatric, geriatric. You have to develop certain kind of strategies. So before leading to general conclusion, you have to follow further that one precise format which is available. Okay, so for pediatric, geriatric, some special pregnant women or lactation women, we can say for that special population you have to follow some guidelines first, and then you can identify such problems over there. Okay. And dose calculation for pediatric is completely another topic to discuss.
Yeah, dose calculation for the insulin is the another topic to discuss definitely.
So dose calculation we are not covering for today.
Yeah. Can you explain the data mining? See, guys, K. Sai Chaitanya, data mining and signal detection is the pharmacovigilance part, and we'll do that. We'll do one webinar on it.
That is also one deep talk we can organize.
Absolutely, absolutely. Can you do a session on narrative writing? Yes, we will do the narrative writing also. Very soon we are coming up with a lot of things, guys. Don't worry. After Diwali, we have a lot of coming ups for all of you. Okay.
Why the doctors didn't cooperate with family students? Okay.
Okay.
See, doctors are always being cooperative with the family student. If the family students have that capacity to interact with them. Do
I
not
will add to
argue with
this.
the doctors. Please
Yes,
be,
I'll add to this. You please go ahead, Neha. Go ahead.
yes. So that is nothing like doctor didn't cooperate with the family student. Ujjwal Singh, I think he asked that question. See,
I'll also answer this. Sir, there are circumstances where the patients use OTC medications without much knowledge about it, and they keep on taking them continuously and end up having medication-induced problems. So how can we create awareness about, among people about this? There are many banned drugs in India which are there right now at OTC. And guys, see, being the pharmacist, I believe if you want to improve the OTC and use of OTC in India, you should go to the clinical pharmacy. Not clinical pharmacy, sorry, community pharmacy.
community pharmacy.
Community phamarcy is going literally into the shallow in India, and I think you people are just reading community pharmacy only in the books. Okay, if you are really good for the social services, please join the community pharmacy and work for it. So you have to interact directly with the patients, with the not only the patients, with the community, with the society, encourage them with the camps, distributing the medications and helping them in reaching out to the drugstores, to the doctors, and helping them in medication adherence, helping them in the what we say the patient counselings. Multiple things are there, but this is a kind of selfless job right now in India. Nobody is going to pay, as sir was telling, make money, but it's not really very easy in India. Okay, so community pharmacy is a kind of selfless service, and that is the only way I believe to improve the awareness or to create the awareness about the OTCs. Okay. Okay, let me come to this question. Why doctors are not cooperative with this? See, first of all, guys, that is not doctor's problem. Okay, there may be some problems, some doctors with some egoistic or competitive feelings. Okay, but all the doctors, if you are going to them and selling the idea that you are useful to them, okay, you are the helping hands to them, not a competitor. Okay, so if you are going to them and tell, sir, we are here to help you in your scientific, enhancement, in your clinical research, in your, will be very helpful as the physician's assistant, writing the prescriptions, taking care of your, history checking because you don't have the time. So if you are, talking to them nicely and selling the idea of that you are the helping hand, but not a competitor, I'm very sure nobody will deny helping you back. Okay, but you are always in the pharmacy when you are entering to the pharmacy second year, third year, and you feel like, oh, I'm reading for 6 years and MBBS people are just studying for 5.5 years. Why? They are more competitive than us and they are getting a lot of money. So you have to understand that fine line between the medicine and pharmacy. These two are different professions. Okay, if you want to prescribe the medicines, go and join MBBS. There is no use of wasting your time in pharmacy. Okay, and bluntly I'm saying, if you want to do MD is first of all not at all available in India after pharmacy. If you want to do it from Canada, Australia, or USA, wherever it is available, there is a 5 years course, 5 years integrated course that you can do after 12th class also. So no need to waste your time and your father's money in the pharmacy. Go and immediately join that MD. Okay, but don't have that myth and come up with the same question as always, like why can't we do the MD and practice in India? Because you have to understand the fine line. You have to be very polite, very humble when you are approaching the people. You are new to India, you are new to society, you are new to people. Okay, you are new to doctors. They also take some time to understand that, digest that. Maybe some multi-centric hospitals, or maybe some tertiary care centers, they are very well aware now because you guys are posted there. But when you are going to the small doctors clinics, or primary care centers, or so, they don't know you. You have to tell them what you are, what you can give them, how you can help them in the research, in the prescription audits, how you can help them in the medicine history taking, how you can help them in the patient counseling, how you can save their time. So nobody will deny, nobody is so egoistic and so they can refuse the help. Okay, because you are directly helping them and you are also getting benefited of learning from them. right? So be polite, be humble, and then approach. Nobody will deny. Okay, that's from my side. Medical coding, okay. A lot of other questions, okay. Like nothing, we weren't allowed to visit the hospital. That's your that's your college problem, not the doctor's problem.
Is
Okay.
it a hospital?
If your college is approaching nicely and with all the legal aspects, nobody will deny. And I have seen a lot of colleges which are, just cooking the cases and showing you and telling these are the real time cases from the hospitals. I don't want to name, but you guys are just in the black side of the mirror. Okay, it depends on the way you are going to approach and sharing your knowledge. Absolutely, absolutely. Okay, so if any questions, you please guys post here. We can take the answers later. It's almost 1 hour 46 minutes. So thank you everyone. And okay, attendance form I think we have shared. Let me share once again, and we can then just wind up, guys. Okay, we can then wind up. So just one sec. Here's the form, guys. Okay, so thank you Neha for joining us, and best wishes for the book, and please come up with something more in the upcoming years. Let us start the new project, new book, so it can help the people. Okay, take care, take care. Good night everyone. Good night, take care guys. Thank you, take care. Thank you.